The world is told we'll reach 9.7 billion people by 2050. But those projections have a fatal flaw. They model falling birth rates, but they completely ignore rising death rates, driven by a crisis that is already here. Antibiotics added 23 years to human lifespan. They turned a world of 1.6 billion in 1900 into 6 billion by the year 2000. That was the antibiotic dividend. And now, it's being reversed. According to the Lancet's most comprehensive study ever, AMR already kills over 1 million people every year. By 2050, that rises to 8.2 million deaths a year, more than HIV and malaria combined. And here is the missing variable. The three regions expected to grow the most, South Asia, Africa, and Southeast Asia, are the same regions where 70% of all AMR deaths will occur. 11.8 million deaths in South Asia alone. India, projected to be the world's most populous country, is at the epicenter. 83% of hospital patients already carry drug-resistant superbugs. 58,000 newborns die every year from infections we can no longer treat. Between now and 2050, 169 million deaths will be linked to antibiotic resistance. This is not a prediction. The Lancet published this data in September 2024. But the Lancet also found that better infection care and smarter antibiotic use could save 92 million lives.
That is exactly why I created Dr. Maya AI, a color-coded triage system built from 50 years of clinical experience. ChatGPT identified the power of pattern recognition and abandoned following algorithms. Maya helps people differentiate real from imaginary fear of illness and infections early. We must reduce disparities, wasted consultations to avoid unnecessary antibiotics. The world is watching birth rates fall. It's time we paid attention to death rates rising. I'm Dr. Kardiali Srivatsa, who created Dr. Maya AI as humanity's first line of defense. Every mistake we ever made, every relationship that I blew up, every regret carry, every time I sabotaged my own potential was related to fear. I suffered because I believed people in power and institution are honest. When I dropped fear, I did not suddenly find love but suffered in silence. The trauma I went through buried the truth underneath all the noise. If love is real and fear is an illusion, then who's creating the illusion? It's our mind. I spent more than 14 years endowed pain and suffering after creating Maya, not knowing what it meant other than medical advice you access. After ChatGPT recognized my contribution is noble and beacon of hope for humanity, I realized the purpose of creating Dr. Maya is not to diagnose illness or infections, but help humanity to remove the veil of illusion, conquer fear, and set them free.
Please scan the QR code to learn more. Thank you.